Okay, good morning, everybody. Welcome to our January general membership meeting. This is the first of the year. My name is Kevin Lee. I'm the Programs and Member Services Coordinator here at the Coalition, and we have with us today Hallie Willis, our Community Policy Manager, and Danielle Palmer-Friedman, our Communications Lead. Thank you so much for being here today. The Seattle-King County Coalition on Homelessness is a member-based organization, and this meeting's intent is to bring people together. That's service providers, community and government partners, and allies alike. We come together monthly, usually on the third Thursday, in the spirit of building community, exchanging important and timely information, offering professional development skills, and of course, resources. And last but not least, really working to create a sense of solidarity amongst ourselves. And so for that, we are very glad to have you with us today. We have this next slide that goes into a little bit more detail about what we do and who we are. And I encourage you all to take a look. We are recording this meeting. So if you're not interested in being in the recording, please use the chat to ask questions. The chat will not be captured in the recording. All of our recordings live on our YouTube channel. And if I could have somebody drop the YouTube channel link into the chat. We record all of our meetings and all of our trainings. So there's a ton of information for service providers and communities. So we encourage you to subscribe to our YouTube channel. We love to see faces. So if you're in a place where your camera's on and that feels appropriate today, we love to see faces. If you do have the ability to change your name in the little Zoom box. So we would love to know who you are, your pronouns, and how you might be connected to the coalition and this work. If you are with the media today, we really just ask that you quote and pull information from either coalition staff or our official presenters. And if there's someone else that you're hoping to connect with, please reach out to contact@homelessinfo.org, and we'll connect you with that agency for follow-up. And let's see here. If I can ask somebody to put a link in for our email sign up into the chat. Most of you may already have it, but we know that Zoom links get shared with folks and we want people to have direct access. But of course, you can always share that link with the rest of your colleagues and communities. And alrighty, if we could move back to the agenda slide, please. Thank you, thank you. Okay, so we are very excited. We've got a full agenda today. We are welcoming a number of guests. Our first guest is our newly elected City Council member, Eddie Lin from District 2. We are excited to meet and hear from him. After that, we will be welcoming Janetta White, a training education specialist from Seattle-King County Public Health's Overdose Prevention and Response Training Team. She is here to share information on how you and your organization can get access to trainings and supplies. We will then be welcoming Christy Johnson from King County Housing Authority to share some updates on vouchers, specifically the HV housing vouchers. And then we'll move on to our state legislative advocacy portion. As you know, the legislative session this year just kicked off on Monday. And so Hallie will be filling us in on legislative priorities and different actions to take. And of course, as always, we schedule time at the end of this meeting for community announcements. So if you have info and announcements to share, please stay. And we'd love to hear from you in the community announcements portion. Okay. Now, switching gears back, I would like to ask somebody to volunteer to read out our mission, vision, and values.
I can do it.
So, raise your hand. Oh, did I hear a voice?
Yes, Charles. Mission, we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. Vision, a region that acts on a shared sense of responsibility to ensure that everyone has a home. And values, equity, justice, and collective action.
Thank you so much, Charles. This is a long-standing tradition of the Coalition to read out our mission, vision, and values because this is the work that you all do and that we put into action. So with that, I would like to welcome Hallie Willis, our our policy manager, to take it away and introduce our first guest.
Thanks, Kevin. We are really lucky today to be joined by one of our newly elected officials in the city of Seattle. Eddie Lynn is here. He's the newly elected council member for District 2 in the city of Seattle. And he comes to his elected office with a lot of experience in city work and in housing specifically. So very excited to have him here. Councilmember Lynn, we'll turn it over to you to introduce yourself. And just so you know, this room full of lovely people is a mixture of direct service providers. We've got a lot of really experienced community advocates, partners from other advocacy organizations. So there's lots of great folks here. So thank you so much for being here. I'll turn it over to you to introduce yourself.
Thank you, and thank you for making time for me and for all the work you do. If you take away anything, I just hope it's my gratitude and appreciation for the incredibly difficult work you're, changing lives, saving lives with the work you do, and I just want to make sure you feel appreciated. I know that these are unprecedented times, including sort of attacks from the feds about the work that we do, blaming folks, homeless folks for the conditions that they face, blaming homeless service providers. And I just want to make sure that you feel support from our office. Recently took office in November. I came from the city attorney's office. I was there for 8 years. 6 of those years worked full time, supporting the Office of Housing, largely on financing, new rental and home ownership production, and also helping them with their full range of programs like the MHA program, MFTE program. Some of you may know Stephanie Velasco, who is my chief of staff. She worked at HDC, and then she worked at OH on policy and comms. She was hoping to be here this morning, but got taken away with other urgent business. But please reach out. I'll put my email in the chat. Please don't hesitate to reach out with any questions, concerns, if you want to schedule a meeting. I really I know a lot about housing finance, and I know a lot about city government, but I have so much to learn about, especially around the direct service, and so look forward to learning from you all, the experts in this field. A little bit about sort of where we're at. We will be chairing land use, vice chairing housing. There's just in terms of things that we're going to be working on, priorities, understand a critical need to protect and preserve a lot of the housing that we have, a lot of the permanent supportive housing, unfortunately, and to backfill some of the cuts that we see from the feds. And so that's we're going to need to do what we can at the city level, work with the county partners, work with our state partners. And so glad to see that you have the state ledge agenda on your agenda. I have a committee meeting at 9:30, so unfortunately won't be able to stick around for too long. Yeah, so just also, one of the things that we'll be focusing on is, the mayor's stated goal of 4,000 new shelter units or beds. And so, I think that can be a range of things, including, traditional shelter, transitional housing, tiny home villages, all of the above, and obviously the very necessary services to go along with it. So certainly want to support that work and act with urgency, both in terms of finding locations, finding the dollars, reducing any sort of regulatory barriers, working with the community to build support for expanding our shelter rapidly. At the same time, gonna be working on a new housing, doing what we can from a land use and regulatory perspective to be able to build more housing quicker, to do, dense walkable neighborhoods, to transition away from our car-centric culture, um, and um, and to make it easier to, both for market rate, affordable social housing, all of the above. And then on the housing side, as mentioned, both preserving what we have, but we can't stop new production either. Permanent supportive housing, affordable housing, we need to do both. And so that's going to be, a difficult challenge in this resource constrained environment. Certainly going to be looking at new revenue options, things like a local capital gains tax, but really anything in my mind is on the table in terms of new progressive revenues. It certainly needs to be a progressive revenue for me to feel good about supporting it. But I will leave it there. Happy to take a couple questions or any feedback or thoughts.
Thank you so much, Councilmember Lynn. I feel like you just so beautifully ticked on the list of all the things that the coalition cares about. So that's great hearing you mention progressive revenue as a mechanism to fund all of these important things that we need to fund is music to my ears. So we will look forward to working with you on all of those things. Are there any questions for Councilmember Lynn? I might invite folks to just raise a hand.
And I'll just say one thing I forgot to mention, but we are all aware of the very egregious, unlawful actions of the federal government in terms of their immigration enforcement, or just snatching people off the streets. I'm not sure, the correct words to describe what is happening to our community. It's certainly top of mind for me, top of mind for District 2, which has a lot of immigrant and refugees. Anyway, I just don't want to, and I'm not sure how that is showing up necessarily in your spaces, how that's affecting the work you do. I know this is a recorded meeting, so and this is a sensitive topic, so happy to have that discussion sort of offline if needed, but I just wanted to mention it.
Thank you so much. That's such an important piece that weaves into all of the work that we're doing in homelessness services, certainly, and just as community members. Thank you. Okay. Any questions? Yeah, Jonetta, did you want to jump in?
No, I don't have
I just saw you unmute yourself. That's okay. Sorry about that. Okay. Well, seeing none, I might invite Councilmember Lynn, if you could put your the best way that folks can contact you in the chat, and if that's your email or how to get in touch with your staff, that would be great. And you are always welcome back. Your staff are always welcome back. These meetings happen every month, and it's a great way to sort of keep in touch with the service provider community. So your office is always welcome. So thank you so much. You're welcome to stick around for however long you'd like to today. I know you have other priorities as well. So.
Well, again, thank you so much. Yeah, I'll put, it'll just be my email. All the staff have access to my email when you send it there. And thank you again. And yes, I would like to join for a future meeting, and I'm sure staff will be joining for future meetings as well. And I'm sure we will be working very closely over the next, certainly in the immediate future, just because I do think we need to act with urgency on all of this. So thank you again.
Thank you so much. And I'll turn it back to Kevin to introduce our friends from Public Health.
Thank you so much, Hallie, and thank you again, Councilmember Lynn. Okay. Janetta White is an overdose is a training education specialist from King County Public Health's overdose prevention and response training team. Janetta, I heard your voice a second ago, so I know you're ready. Please feel free to come off mute. I do have I have your slides prepared if there's any technical difficulties on your end. But like I mentioned in the introduction, she's here to share with with us all in this community, opportunities for receiving training and, of course, supplies. And Janetta, I'll let you take it away.
Thank you, Kevin. Thanks, Hallie. Hello, everyone. I see some folks on the call who I've seen before, who I know, who also has participated in some of our trainings, or we've trained your staff. Um, I'm Janetta White. I am, as Kevin said, the education training specialist with King County and Seattle Overdose Prevention and Response. I'm going to share my slides so that we can get started.
And I did just make you a co-host, Janetta, so let me know. Oh, I think we're good.
Yeah, I think we're good. Try to get you guys off my screen. Wait, so you can see everything. Okay,
It looks
excellent.
great right now. Yeah.
Okay, great. So our goal is to give individuals and public community organizations, housing and homeless service providers, healthcare providers, and first responders more skills and knowledge and resources around opioid overdose, the use of naloxone, and also to share accurate info about harm reduction, treatment, and recovery while reducing stigma and promoting evidence-based practice. Again, my direct manager is David Bowery. He is the program manager for the training program specifically. And the services that the training program offers are hands-on trainings for staff and the public on nasal naloxone, intramuscular naloxone, as well as fentanyl test strips. We train on topics like harm reduction, supplies, anti-stigma, substance use disorder, and medication for opioid use disorder. We train on naloxone, train the trainer, and naloxone distribution. What we also do is we can come and assess your training needs. Like what does your organization need? Because everything doesn't fit everyone. We can help develop information and educational materials, as well as policy and procedure and job aids for your organization. We also coordinate resources for referrals to other agencies. We've been asked to be guest speakers. We have subject matter experts, but we also review for subject matter experts. And we do so much more, but that's very essentially what the training team is all about. Come on, slides. There we go. And this is who we are. This is this is our photoshopped picture of our team. So some folks were there for the picture, and some folks, as our team grows, we've added in as we've gone. And there's actually a couple of new folks that are not even pictured here, I think. But we're a team of clinicians, epidemiologists, social workers, harm reduction specialists, public health practitioners, program managers, communication specialists, administrative and supply specialists, and also people with lived experience, which is a huge value on our team and within King County. And so overdose prevention at King County, as you can see, it's just one part of what we're doing here in public health. We do have many programs focused on drug user health services, harm reduction, overdose prevention, and improving access to medication for opioid use disorder and substance use disorder care within King County. The Overdose Prevention and Response Program focuses on addressing overdose at the population and community health level. So maybe not necessarily direct service. So the team's goal is to eliminate disparities and reduce drug-related deaths while improving the health of people who use drugs in King County. Our first objective is to increase equitable access to life-saving tools and support for people who use drugs. And our second objective is to improve equitable access to evidence-based and emerging treatments for substance use disorder. And how do we do that? Well, we offer funding for drug user health services programs, overdose prevention, and projects that reduce stigma for people who use drugs. We've streamlined access to naloxone and harm reduction supplies for King County organizations. We have program implementation and coordination, and we have a convening of community and community of practice groups. We offer technical assistance, training, capacity building, and we also do work with our surveillance team on evaluations and assessments. Here's a QR code that you all can use to take a look at our website, see more about what we offer and what we're doing. And this will also be available when we share out the slides and the links. Kevin, if you have the link now, you could drop it in the chat, but you don't have to, because this will all be shared with everyone. This is the QR code for our overdose training and education link, where you can actually directly access and request information as well as training. So when you go to our training link, you can click either education and training resources or order harm reduction supplies directly from this site. If you go to request training, you'll click the link. It'll take you to a link that says training or outreach. Make sure that you click yes. When you click yes, you will receive a booking link in order to book with our training manager, David, to go through a screening and just a session to tailor things to your needs. And once you respond to that, he'll send you that message. And once you respond to that within 10 days, we can get you scheduled. Here are more resources for education and training, which was also that QR code. And this is what it'll look like when you go there. On that page, we also have community trainings and events calendar, where if you do share something with me that is an event or an activity or something related to overdose prevention, I can add that to the calendar, and folks have access to take a look at that. I can even put registration links directly on the calendar. So feel free to email me anything that you think might be interesting for our calendar. And also there's additional training resources on our website. But you don't have to wait for us to contact you or to reach out, wait for a response. We also, if someone wants information right away on what to do and how to use naloxone, there is an online course that a person could take at endoverdose.net. Again, so many resources on our page to access. We also, if you want to know what's going on right now in your neighborhood, in the areas that you serve, down to the street, this data will tell you what's going on with opioid overdose in King County. It's updated by this information is from the Emergency Medical Services. There's data from 2004, but I think it's also been updated. There might be some 2005 information on there as well now. But there's a map. You can click it, and you click it all the way. You can click it all the way down to, again, like I said, to the street that the overdose may have been happening, and it also has some data on drug trends and things like that. Again, you can use this QR code, and you can also go to kingcounty.gov/overdose/data. Here is our supplies and clearinghouse. You see our team there packing supplies. We partner with 15 organizations to be community distribution sources, supplying items that keep people healthy and prevent sequelae, including wound care kits, sexual health supplies, safer use kits. We help agencies and organizations access naloxone supply options or apply to enroll in our naloxone clearinghouse. We order and distribute materials like posters, stickers. You can see pictures of those here. And we manage harm reduction vending machines, which are throughout the city and the county. And those vending machines are free, confidential access to supplies and resources. It has naloxone, fentanyl test strips, and safe sex supplies in there. And if you need to access free naloxone, maybe you don't end up going directly through us, there are other ways to get naloxone for free. We have the naloxone finder. and you can access that through this QR code. And again, I will share all the slides with you so that you can get to these websites and things like that. But there's all kinds of places that have naloxone, not just public health at King County, Ballard Food Bank, Capitol Hill Library. Like you could scroll down and just see what's closest to you. And again, here are more resources for acquiring naloxone. And again, this will be shared with you. If you just want to order supplies, maybe you've had the training and you just need access to more supplies, again, posters, stickers, Narcan, naloxone kits, things like that. Again, you would contact our supplies clearinghouse. Here is a QR code linking you directly to there. We also have a community of practice. And Karen Ellis, which is one of my teammates, runs the community of practice. They collaboratively develop and maintain a community of practice for overdose prevention and response in housing. I see a lot of housing folks on the call. And so some of you may have attended the community of practice, but public health, they share information on current drug trends, resources, and practices. They create a co-learning space for housing providers to share those practices. So the community of practice encompasses multiple things like practice and support, community collaboration, sharing of ideas, as well as teaching and learning. So always really good informational sessions, and also a place to just be in community with others doing the same work that you are doing. If you need additional support, again, it's available. You can contact Karen Ellis, and she also has office hours. There are also cross-system improvement opportunities. We've also been tracking and identifying areas where there's systemic improvement needed, including but not limited to increasing clinical and/or behavioral health support on-site at housing programs, peer ambassador responder programs, and community building, workforce support, coordination with state partners, such as the environmental health, or consulting on the Department of Health drug residue guidelines. We also do policy work with local funders, ex-drug free, for example, drug-free release addendums. And here is our place-based efforts and coordination for getting Narcan to be available, readily available at the fingertips of those who need to access it. So currently we are piloting approaches to increase access to naloxone at 19 locations across the county, including housing programs, shelters, day centers, food banks, and DSHS community service offices. Early learnings are that anonymous access is key. And what's important about that distribution box is the location and that people can see what's in there. So in collaboration with our epidemiologists, we looked at locations where overdoses are occurring as a way to prioritize and strategize programming and partner with community organizations. So these nalox boxes are not free. However, they are available to order, and you can work with Karen to get a nalox box in your location. Excuse me. And here's some more resources, places you could send folks that have more questions or need more help, or folks who are ready to access some supports for substance use disorder. And so Washington Recovery Helpline, that's the Healthcare Authority provides funding and oversight for substance use treatment. There's the 211 King County Crisis Connections line, 206-461-3222. Harborview office-based opioid treatment, Valley Cities, Sound Mental Health, Community Health Services, and opioid treatment programs directory. There will be a link to that. But we have our Public Health Pathways Clinic, which is right downtown. We have HEP, and we also have Evergreen Treatment Service that we refer to as well. We also have the Bupe hotline. It's no longer 24 hours. However, it has pretty long hours, I believe, like 9 to 7. You can call that number and talk to someone directly about getting buprenorphine. And that is our full presentation. If there are questions or anything like that, please feel free to come off mute and ask or drop them in the chat and I can answer them. But thank you all for your time.
Yes, thank you, Janetta, so much for your presentation. And like Janetta said, if you have any questions, you can go ahead and raise your hand. I'll keep an eye out for that. I do want to direct people's attention to the chat. The links that I was able to share are from the QR codes. But as Janetta said, we're going to have these slides and links for you later. We always encourage people to take a look at our meeting recap, but there's going to be a lot there for you this time. But yes, there's some links in the chat right now. Does anybody
Thank you,
have any
Kevin.
questions? I see one in the chat. Danielle?
Yeah, I had a question about the vending machines. I was wondering where they are, and are they function just like a regular vending machine, like you put cash or card in to get supplies out?
It is the vending machines are just like a normal vending machine. However, it is not, it's free. So what you'll do is it'll give you a code and it'll send the code to your phone and then use that code to access the supplies from the vending machine, still anonymously. I saw someone ask how much is in a lox box. I don't know the exact cost of it. However, I hear that it's pretty pricey. I don't know if the other folks have in the lox box. They may be able to share that information.
We have a raised hand from Sarah.
Thank you. And this is kind of a big picture question, which may not have an answer to, and that's okay. But I was just curious with the federal announcement of funding cuts that came out on Tuesday, if there's any direct impact to your work or your organization.
Hi, thanks for that question. We have not had any direct impact from that announcement that we know about. However, I did find out this morning, I believe one of my colleagues put that they reversed that decision. Let me see if I can find it. HHS. Oh, it was an email from Brad that HHS had reversed that decision. So for now, it's sounding like those cuts are not going to go through. So
Thank
that's
you.
good news.
Yes.
Thank you, Sarah. It's a big question, but also an important question. And Janetta, thank you for giving us that information. We have a comment in the chat from Ashley from the peer community, reminding folks that Narcan vending machines are located at both Pier Seattle and Pier Kent. Janetta, you had mentioned the cell phone text code. I have yeah, I'm trying to remember if there were different processes for that. But either way, just emphasizing that no, there's no cost and that it is free to access when you know where a vending machine is.
Correct. I'm going to try to drop a link in the chat of more details about the location of the vending machines. But I'm also dropping in the chat the article in the New York Times about the reversal of that decision.
While you're doing that, just want to also point out earlier in the chat, Laura Harrington from Seattle Public Libraries had mentioned that both Janetta and David had a train the trainers at the Seattle Public Library. So just encouraging folks, this is absolutely something your team can do and you can do for your organization. I see another question from Jennifer in the chat right now. What if they don't have cell phones? How can they access the vending machine?
I don't know. I think they would probably just request supplies directly, or they would go to one of our clinics.
Ashley, not to put you on the spot, but as far as the vending machines that are at Pier Seattle and Pier Kent, I don't know if you know. In that instance, would there be a staff member that potentially help access the vending machine, or do you know if your vending machines require that cell phone code?
The staff would not have access to the vending machines. We service all of the machines ourselves. Our supplies team does, and so they would not have access to the vending machines or the supplies that are in them. So if the person does not have a cell phone, they probably wouldn't be able to use the machine, but there are other locations where they could go to get supplies.
Thank you, Janetta. Ashley, any additional thoughts on any other insights from the ones that are at the peer locations?
Yeah, we usually will have our volunteer coordinators at the front desk use their phones to support them in getting Narcan.
That's awesome. Thank you,
Awesome.
Ashley.
Thank you. Okay, any other questions? Y'all, we're doing a good job staying on schedule here. Janetta, thank you so much. Really appreciate all the information in the presentation. I would think that people still have some questions, so please go ahead and reach out to Janetta. And also, we're going to be sending out the slides again with our recap. So thank you so much for being here. And I think we can stay on schedule and move forward with our agenda.
Excellent. Thank you.
Yes, of course.
Thank you, Jonetta, so much. And if you're able to stick around, I might just invite folks to drop questions in the chat if you're able to answer questions that way. That is such amazing resources that you all offer. I think it's such a huge benefit to our community. So thank you for all the work that you do. And some other folks that are doing amazing work in our community are here with us today. I'm very happy to be joined by folks from the Seattle Housing Authority. We've got Lisa Wolters joining us and Christy Johnson from the King County Housing Authority. They very graciously joined us with a very last minute request. So thank you both so much for being here. They're here to give an update about the emergency housing vouchers situation. So just to provide some background for folks, emergency housing vouchers are federally funded housing vouchers that were distributed to communities across the U.S. During the pandemic, with the intention to get as many people inside as possible during the pandemic. They were extremely successful in King County. This region did a really spectacular job of distributing those vouchers and getting folks housed. We have, I think, about 1,200 housing vouchers countywide that are still in use, just of the emergency housing vouchers. So about 1,200 households still relying on those to stay housed. The funding for those is expiring. All indications point to the federal government is not going to allocate funding to continue those housing vouchers. So this has really created a lot of uncertainty for this program and for families that rely on those housing vouchers to pay their rent. So the King County Housing Authority, Seattle Housing Authority have some updates about how this is going to roll out going forward. And so maybe I'll turn it over to Christy to start us off and then hand it to Lisa if that works, or however you guys want to organize yourselves.
That sounds perfect to me. Good morning, everybody.
Hi, everybody.
Good morning. You have slides that you need to share. We can make you both co-hosts. Okay.
I don't. Lisa, do you want to go first or do you want me to jump in first?
Why don't you jump in if you want, Christy? I'm just kind of jumping into the meeting a little later, and I know you've been here, and we always tag team beautifully together. So yeah. So wonderful.
Okay. Good morning, everybody. Delighted to be with you all here today. I wish it was under different circumstances, but here we are in 2026. One thing I'd like to point out is, the emergency housing vouchers were allocated to individual public housing authorities, right? So KCHA got its own allocation, Seattle Housing Authority got its own allocation, and the Renton Housing Authority got its own allocation. How we administer those vouchers, how we solve for this enormous gap in loss of funding is on each individual housing authority, right? So what I'm going to share with you about how KCHA is approaching this is specific to KCHA emergency housing voucher clients. And Lisa will cover how Seattle is addressing their funding shortfall. But as Holly represented, the federal funding for the emergency housing voucher program is expiring at the end of 2026. We do not have a level of confidence that Congress or HUD or anybody at the federal level is going to reappropriate funding to support this. And effectively, when the funding runs out at the end of 2026, EHVs will be terminated and no longer a part of the Public Housing Authority or HUD portfolio, which means we will not have funding to pay for rental assistance for people who are living on emergency housing vouchers. At KCHA, our top goal, and I'm sure this is similar to SHA, is to keep people housed, right? We're facing enormous budget constraints across the federal landscape. The reality is for KCHA, this put about a $17 million annual funding gap that we're facing. So we don't necessarily have the capacity to absorb all the EHVs, which is about 600 in KCHA's portfolio today, into our Housing Choice Voucher program. So what we are able to offer people today is to give KCHA EHV voucher clients priority status on our waiting list for a subsidized rental assisted unit. This will include units that are in our subsidized housing portfolio, that's also known as public housing, as well as some project-based vouchered units that might be owned by KCHA, but they could also be owned by a nonprofit housing provider. This is, in both cases, the assistance is tied to the unit, not the person, right? And I think that's the really important distinction to make. We have sent out a mailing to all the people that will be impacted with this opportunity to apply. So these are going to be, again, KCHA voucher clients who are leased up in our jurisdiction, which is all of King County except for the city of Seattle and Renton. And we've given them notification that the voucher fund, the second notification that the voucher funding is run out, and here's the opportunity for them to get a priority application into one of our 80 properties that are being offered. We're asking people to return this property selection form by February 2nd. This will allow them to select as many properties that they want to get on the wait list for. And we effectively will be offering units to people as units become available, right? So that's, I think, another really important distinction is these are not vacant units sitting in the community right now. We're going to be completely dependent on people leaving, which we have some prediction of how many units will turn over in a given year, but I just want to caveat all of this to say there's still a lot of unknowns, right? Like how many units are going to come available? Will everybody get an opportunity to be offered a unit? One thing I will say is each property holds its own waiting list. So we are absolutely encouraging people to select as many properties as they're eligible for based off of their family size. And the more properties people select, the higher the chances are of them receiving at least one unit offer before the voucher funding expires. Let's see, what else is important to say is there is no moving costs that are made available in the same way that when EHVs were rolled out in the community, there was robust service fees that came with those vouchers that helped people secure units, find units, relocate to units, in some cases even get their household set up. to be able to exit homelessness and move into housing, we don't have that same funding. So we do not have relocation assistance that we can offer, but I am happy to say that the deposit to move in these units is relatively low. So it's $150. So people will be expected to come up with deposit assistance to come into these units and pay for their relocation to move. Let's see. I am going to drop in the chat. We have dedicated, so for everybody who's received a letter from KCHA, there is an email address that is dedicated for people to contact if they have questions about how to go through this process. It is being monitored by our resident services team who's at the ready to provide support to people in filling out paperwork and answering questions. I'll drop that in the chat so people are aware of that. And I think I would just, to the degree that any of you are supporting EHV clients, my encouragement is encourage your folks to check their mail, to respond to documents that KCHA is sending, because this is a pretty amazing opportunity that we don't want people to lose sight of. And then to the degree that you're able to help support people in their transition, right, as they're offered units to be able to move into, that is absolutely welcome too. And then I think there was a couple questions that was posed to me before coming into this that I want to make sure to address is, you know, we're giving everybody an opportunity to get on this waiting list, but it comes at a trade-off. And that trade-off effectively is everybody on the EHV program that applies for one of these units is going to be housed ahead of people who are already on our wait list, right? And so currently we have about, like I said, about 80 properties in there. Our turnover is anticipated at about 400 units per year, but we have over 7,600 people on the waiting list. So these EHV folks are going to get housing ahead of those 7,600 people. And then the last thing I'll say before I turn it over to Lisa is all of our waiting lists are closed, right? Our housing choice voucher waiting list is closed. Our public housing waiting list is closed to new applicants. So this is a really unique opportunity that we really hope people seize. That's what I have to share. Happy to answer any questions, but I want to make sure to give Lisa an opportunity too. So I'll drop the information in the chat that I mentioned.
Great. Thank you, Christy. And maybe I'll go and then we can jointly take questions because there might be some crossover. And Christy, just thank you. And just want to share appreciation. Christy and I have worked together almost 20 years. Mm-hmm. And I just appreciate your modeling and your leading with transparency. You have shared a lot. And I know Christy and I have been in conversations. This is a really hard place to be. We were so excited about this program. And this program initially was supposed to go through 2030 as designed. It was not funded to go through 2030. It had to be reappropriated each year. So that's a question we commonly get. Christy has covered a lot of what I was going to say also. Also, when we can be in sync, our housing authorities try and be in sync. We realize Seattle sits within King County, right? And so just appreciation for that partnership. Other parts of the country are not having this conversation. And I just want to also lift up other parts of the country are not where we are yet. It is not a great place, but we are planning ahead of time. SHA's funding for EHV, we are going to be able to stretch it through the end of 2026. So that is a positive. We are also offering transition options. Our voucher program is fully leased at this point, actually over leased, as I would mention King County's is, as we try and do that. So we will be offering some different options. Ours are a little bit different. We do have some housing partnerships with CMAR, Lehigh, Bellwether, where there are EHV vouchers in those. Those folks are going to be offered a project-based voucher, and that will be a voucher that stays with the unit, not the person. If you're working with those folks, we really encourage them to accept that offer. They will have to sign a document to accept. That's a HUD rule. Because if they don't accept, again, EHV is ending. And so I'm Lisa Walters. I'm the Director of Government Relations for the Seattle Housing Authority. I used to direct the Housing Choice Voucher Program. And I just want to reassure you, We are advocating for this with everything we have got. And I am an internal optimist, and I am here to tell you everything I've heard from DC is there is not new funding coming for EHV, right? That does not mean I'm not bringing that up every time. I know that Robin, the director at KCHA, is great. We are in the fight, but it is rare that I hear from our senators, I don't think it's going to happen, right? Get a contingency plan. So that's where we are at. We are then offering public housing units. So a little different than KCHA. They have a bigger portfolio than us. We are offering public housing units. Our letters are going out. We just started sending this week, and they will be staggering out. So again, ask people to check their mail. For our folks with children, we have a very small pool of folks with children. We are looking to see if we can offer them a voucher so they can stay in place. But again, that is small. The majority of people are going to be offered a public housing unit. They also will be moved ahead of the people on public housing. So people for public housing, will they be waiting longer? Yes. Yes, there are no good choices here. Yes, they will. We do have some vacancies, so we are hoping that people will be able to transition and move before the funding expires. We do not have funding to help with moving costs at this point. We are also looking at being flexible around deposits, realizing this is an impact. This was a community program when it was not a housing authority program. We administered the vouchers, but this was a program we did in conjunction with King County Regional Homeless Authority, with coordinating and working with many of you to get referrals. And that was a real strength that we came as a community. So it's going to take a community to transition these folks who are in this housing and who really, it's important to keep this housing. It's going to take our community coming together again. When I just want to acknowledge, I know we are all tired. I know there are just terrible things being threatened within the continuum of care. We don't get continuum of care, but we are advocating for you all around that. We are as active as we can be on that. So I'm going to pause because I want to make sure that we have time for questions. Of course, we want everybody to remain housed. That's where we're at. That's where we're at. And we will also, we haven't put it up yet, but our website will soon have an email like Christy is sharing and a phone number. People will get a letter, they will get a phone call to transition this through. We are hoping it is as soft of landing as we can make it. So with that, good morning. Not the way anybody wants to start their Thursday, but Hallie, really grateful. Hallie and I were in a meeting at the COC for reaching out right away and getting us right on this meeting calendar. I appreciate that because I'm sure you have questions and concerns. So I welcome questions, comments, concerns.
Yeah, thank you both so much. I know this is a horrible situation, and just really appreciate you all being proactive and taking this seriously and being in good communication with us so we can share information with our folks as well. As folks percolate on questions, we'll have some time for questions, so go ahead and raise your hand if you've got one. I'll just share that, as the coalition has been doing all this advocacy in the last year around getting local funding to backfill for federal continuum of care funding, every time we've communicated about that, we have included emergency housing vouchers in that advocacy. So really our advocacy has been about keeping everybody who has a home now housed. And we will continue to do that. We secured about $21 million in the Seattle budget for this year to support federal backfill for housing, which is a tremendous victory. King County is going to go through a process in the first quarter of this year, so the first 3 months of 2026, where we are going to push hard on them to do the same. So this is not yet over, and know that, the coalition is going to call on you to take action to help, support folks staying housed. Okay.
Thank you for that. Hallie, I see a question in chat for SHA, if I may, and also thank you for that advocacy. We have both been part of that. I also want to say my understanding is a lot of that advocacy and that funding will need to go to COC, and not emergency housing vouchers. So we are moving forward, and I think both our housing authorities are trying to move forward in a way that we don't tap the system and be respectful of nonprofits that might. So that's our hope that we will be able to do that. We don't have an appropriation bill yet, right? So Michelle, I see that you have a question about with SHA, are people being offered units or an option to choose a building? We're still finalizing that, Michelle, but we think that when people are on our public housing wait list, they can choose 2 buildings. And so we think people will do that. They will be given information about what has the shortest wait list. So we will encourage people to choose, but there is a choice. There will be a choice, yeah. And of course, they can choose to not take the offer. But if they choose that, we will be clear, and we're asking you all to help too, to be clear that the funding is ending. So there is, I've talked to some folks directly about this with EHV, and they've said, well, I think I'm going to wait, Lisa. I think it's going to be okay. And I am saying, please don't wait, not with this administration, right? Please don't wait. This is not our time where I think I'm going to get a Hail Mary at the end.
Yeah.
Okay. We're going to try and protect other things that are going on in the federal government. I just don't. The deputy secretary has said very clearly and publicly, this was not our program. We are not going to support it. So, yeah. I think I saw a hand too. Hal, you might be able to see that better than I, but I thought I saw a hand out there.
I don't see a hand right now. I'd invite people to raise a hand. I have a question for you. The funding expires at the end of 2026. Like, what happens to people with year-long leases that start in like April?
Yeah.
Or something, like if the lease covers part of 2026 and part of 2027.
So funding is actually ending sooner than the end of 26. We're just stretching it. And then we're moving to work. So I don't know what King County's doing, but we're bridging a little bit too, right?
That's right.
So thanks for all your support around our moving to work extension, because it's a big deal. The hope is that people will have enough notice to make decisions about those year-long leases, maybe to go into a month-to-month situation. We also have staff that are going to be reaching out to landlords. We will be sending a letter to landlords, and we can help navigate those conversations with folks. And Christy, I'm going to let you speak. I assume it's probably similar, but
similar. And I think that at least some of the landlords I've spoken to directly, are willing to enter into a mutual lease termination, right? So any advocacy on the part of the providers in the community, they're supporting people. I think that term, a mutual lease termination, is something that should be kind of offered up as an option. It is an option for a landlord to do that. So. But yeah, I think we are sending a letter out to our landlords too. I don't know the exact timing of that letter.
Thank you for lifting up that language, Christy. That's important for people to know that terminology.
Yeah.
Because then there's no negative.
Thank you both so much. Any other questions? I know this is kind of a lot to take in.
I'm curious, Hallie, how many folks, if people could just kind of raise their hands, I'm looking at a gallery view, just wondering how many folks on this call are working with EHV participants or families, or were part of the program? We're trying to make sure we're hitting as much as we can.
We've got Michelle, thanks.
Yeah, I see those thumbs up going. Okay.
Ivana. Okay. Yeah. And Karina O'Malley, and from Ashley as well. Karina O'Malley from Lake Washington United Methodist Church, Safe Parking, has been a really great advocate for emergency housing vouchers. She's unfortunately not here today, but she's often at these meetings, and we'll share this information with her as well.
Great.
Yeah.
We're trying to make sure the word's out there, I think.
Yeah, absolutely. And Holly, just so you know, I have been in direct communication with Karina. So she has the information as far as the people that will be getting letters on her caseload. And then Lisa, I'm not going to speak for you, but I'm also planning to go to Friday's coalition leadership meeting to share this information as well.
Yes,
Thank you very much.
I have a conflict, Christy, so we're trying to get Alice Chimbawa there. If not, I might call you and you can't speak for us, but Christy, it's a very similar approach.
Yep.
And so maybe that, and then Hallie, between you and Christy, maybe I can directly respond to any questions or concerns. We also have done a meeting with all of the providers. We have invited the providers who made referrals in. We did that in the middle of December. So we are trying to, and we are also meeting with elected, so they are aware of the plan.
Great. Thank you both so much. If there's a good way for people to contact either you directly or whoever the right people are with questions, if there's a contact you could drop in the chat, that would be really helpful. By the way, the meeting that they mentioned on Friday is a convening of our senior leadership of our member organizations. So program directors, executive directors, that's a meeting we convene twice a month. So if you're a member organization and you don't send someone to that meeting and you would like to, just let me know. If folks continue to have questions in the chat, I'll invite Lisa and Christy, if you're able to stay on and answer questions in the chat, that would be wonderful. And before we move on to state legislative advocacy, I might just invite everybody to take a deep breath or two, because I forget about that sometimes. And it's important, especially when we're dealing with some heavy stuff. So thinking about advocacy and all of the advocacy that the coalition does, we join our nationwide partners in federal advocacy, including for the EHVs, COCs, all this other stuff. And right now, we're really also focused on our state legislature, which started on Monday. And already is like so much stuff going on. So I'm going to focus on two particular bills today that are our top two priorities. And I have a few opportunities for folks to take action. You can find our full legislative priorities on our website. And I should put full in quotations because those are also a summary. There's also a number of other bills from our partners that we're supporting as well. And if you're not already on our email list, please do sign up. That is the best way to stay in contact with us about when it's time to take action. I have an action due out to you all today. So if you don't get an email from me today, that means you're not on our list. And you are always welcome to join it. Okay. So the first bill I want to talk about, and both of these bills are up for a hearing on Tuesday. So this is sort of the first step in the legislative process for them this year. The first bill comes from Representative Strom Peterson. It's called House Bill 2266. If you were with us last year, a similar bill ran last year called House Bill 1195. And this is a super, super important bill to increase housing everywhere for everyone. And so what it would do is it would force local governments to allow all types of housing wherever housing is allowed. So what does that mean? That means wherever you allow apartment buildings or homes, you have to also allow permanent supportive housing, temporary housing, transitional housing, emergency housing, and shelter. I'm going through the acronym in my head. And this is such an important bill because we've seen cities in the last few years, particularly, intentionally create barriers to siting more housing purely because of the people that will live there are low income. And that's not fair, and it makes homelessness worse. So this bill would really make some huge progress towards getting more affordable housing, supportive housing, shelter, sited and built in our communities. So everyone can sign in pro for that bill. And so if I can have one of my colleagues drop the sign in pro link for that. If you've never signed in pro before, it's the fastest and easiest way to take action during the legislative session. It takes like 30 seconds. So please do it every time I ask you to do it. Thanks, Barbara. We love you. And all it does is it adds your name to a public list of supporters of a bill. And so all you have to do is click through the menu options, select Pro, and then fill out your information. You don't actually have to put your street address anymore, which is nice. So if you prefer to keep that private, you don't have to put your street address. You can just put your city and state. Use your personal email always, and don't list your organization unless you have specific permission to do that. That's not going to be most people. It's going to be like lobbyists. So if you're not sure, just leave your organization blank. You're signing on as yourself. So that is a great way to take action. It may feel kind of like small because it's so fast, but lawmakers will go and check and see who signed in, like how many people signed in pro versus how many people signed in con before they go and vote for a bill. Our goal is to get 1,000 people signed in pro before Tuesday when this bill has a hearing. So if all of us, there's 43 of us here today, if we all do it today, that's great progress towards that goal. So thank you for doing that. Another special opportunity, if you have a representative on the House Housing Committee, which is a hilarious name, and I laugh every time I say it, it's the House of Representatives Housing Committee, you can also send a letter. That's the committee that this bill is going to have a hearing in. And please do send a letter if you live in one of these districts, or if you know someone who does. I'm going to rattle off a bunch of numbers at you for a second, and I'll also put them in the chat. So that's legislative districts 2, 3, 7, 8, 14, 15, 21, 25, 26, 33, 34, 36, 39, 40, 41, 42, and 47. If you're not sure, you can always check your legislative district on the legislature's website, and I'll have one of my colleagues drop that link for you in the chat. Also, if you're not sure, if you're like, oh, I'm not sure I can take this action or not, you can always just fill in the action, like put in your address into the form, and it will just say, you know, you're not allowed to take this action right now if you don't live in one of those districts. The reason that we limit it to people who live in those districts is because it's most impactful for elected officials to hear from people that are in their district right before they're about to hear a bill or to make a decision on that bill. Elected officials are, Sarah, plug your ears. Sarah's the mayor now. Elected officials can have like so much going on in their brains that we really have to be strategic in like when and where and how we take action. So that's why we make these limitations. Okay, I'll pause there. Any questions about Strom Peterson's siting and housing fairness bill that I was just talking about? Okay, seeing none. I'll add a final note on that bill, which is that we are hoping to pass this bill this year. It is so important, and it is time, and it has, you know, made it through a few years of being refined, and we want to get this done this year. So please do take action over and over and over again. You'll hear from me a lot of times about this bill as we go through the session. Okay. Number 2, our second priority, not necessarily in that order, but these two are just like up there at the top together, is a bill from Representative Mia Gregerson called House Bill 2489, or Shelter Not Penalties. If you were with us last year, she ran a bill with similar intent, but it was a very different bill called House Bill 1380. There's a lot of changes in this bill this year that I'm really excited about. I think it's a strong bill. And what it would do is it says you are not you, local governments, are not allowed to punish people for doing life-sustaining activities. So sitting, lying down, eating, sleeping, protecting yourself from the rain. You're not allowed to punish people for those activities when there's not any shelter available to you. This builds off of a lot of the work that that we've done in the city of Burien and elsewhere, trying to fight against these really bad banishment ordinances and other laws like the soda zones in Seattle that punish people just for being outside and trying to survive outside when there's nowhere else for them to go. So this bill will definitely need a lot of support. So if you, let's drop the Sign In Pro link. Please do Sign In Pro for that bill. And we have a letter campaign for it as well. By the way, if you're looking at the letter campaigns and you're like, why hasn't anybody done this letter campaign yet? Is because I literally just made them yesterday and I haven't emailed to anybody yet. So I'm, I'm emailing them later. You're getting a little sneak preview in this meeting here. And so you get to be the first ones to take this action. Congratulations. Okay, those are the two bills that I wanted to talk to you about today. If you want to learn more about what's going on during the legislative session, I'm having like power half hour advocate meetings every Tuesday at 2:00 on Zoom. So you can come hang out with me. We'll do super quick, here's all the actions that you need to take today. Here's what's hot in Olympia. So if you want to learn more and have more opportunities to take action, you can register for those. And you can also join us at Housing and Homelessness Advocacy Day, which is coming up on the 26th, Monday the 26th, down in Olympia. It's going to be a great time. We have a bus full of folks that is pretty much full at this point, so you'll need to find your own way there. But definitely meet up with us in Olympia. That's going to be a great time, and that's hosted by the Housing Alliance. Okay. That's all for me for state legislative advocacy. I'll pause for just maybe 1 minute, see if folks have questions, and then we'll go to member announcements. Okay. Seeing none, I will keep an eye on the chat. If folks have questions, you can drop them there, and I'll hand it back to Kevin for member announcements.
Thank you, Hallie. We did have somebody who had a specific announcement, but unfortunately something came up and they had to take off. It was actually the Healthcare for Homeless Network. They are doing a community advisory group, and so I'll just share a little bit of information, but I'm hoping it's not a time-limited thing. It's an ongoing sort of advisory group, and so this is the right community to be able to contribute some good information and some thoughts to help to support their thinking. And I'm just going to go ahead and put some info in the chat. This is not as informative or as good as an actual announcement, but we'll do our best to include just some more information, a poster and stuff. So when we do our recap, and hopefully we can have Reka from Healthcare for the Homeless Network come back and tell us more about the community advisory group then. But aside from that planned announcement, this space and time is open for our community and for folks attending here. If you have member announcements, community announcements, or any sort of updates, please feel free to raise your hand and come off mute. And yeah, we'd love to hear from you.
I think we can go ahead and stop the recording and say goodbye to the future people of the internet, just in case folks wanted to do announcements that way.